Okay, well, joining us in our newsroom, we have Ed Sandrick from Humana. Ed, please introduce yourself to our audience.
Good morning. This is Ed Sandrick from Humana. I'm the director of the Veteran Channel. I'm here to talk about Medicare Advantage, particularly our Humana Medicare Honor Plan, and I'm pleased to be with you today.
So yeah, thanks for being so much for being here. So let's jump right in. So we have the Medicare enrollment period is open now. How long is it open until? And what should people who qualify for Medicare do in between now and when the enrollment period ends?
Sure. We're in the midst of the enrollment period right now, the annual election period, which began October the 15th and will end on December 7th. So there's still time for individuals to understand what their options are and look at Medicare Advantage plans for 2021. I think at the top of the list of probably could be a long checklist of items would be provider networks. Medicare Advantage plans typically operate through provider networks. So I think everybody should want to take a look at the primary care physician and specialty network to make sure that your primary care physician and specialist is included in the network, and the hospital where they admit to is also included. Seniors, particularly those on Medicare, are typically on fixed income and are taking a look at the budget and cost of things. So certainly the cost of the plan is an important consideration. The premium that you would pay monthly, as well as the ongoing out-of-pocket costs, co-payments, co-insurance, deductibles, those sorts of things. Many seniors are on maintenance medications, so the drug formularies that the Medicare plans offer is important. So you should take a look at the Medicare Advantage drug formulary to make sure that your drugs are included in the plan. And then the expenses overall. So take a look, I think, at what your expenses were this year, what they may end up to be at the end of the year, and try to anticipate what they'll be in 2021. So the plan choices that you make fit within the budget.
So I understand you work specifically with Humana's Veterans Arm. So what can veterans do? What should veterans look for specifically in terms of this open enrollment period? What sort of cost benefits should they look into and weigh before they decide on what plan is best for them?
Sure. Well, the indicators I just mentioned, the factors I just mentioned, are important to everybody, whether they're veterans or not. But veterans need to, particularly those veterans who use the VA, want to look at the very same thing. There's myths and misconceptions out there that if a veteran who uses a VA chooses to enroll in Medicare or Advantage, they would jeopardize healthcare coverage. That's simply not true. Medicare Advantage can complement that an individual gets at the VA. This year in 2021, for the second year in a row, Humana will be offering the Humana Honor Plan, which is a Medicare Advantage plan with prescription drugs, again, to complement the VA health. Typically, most veterans who use the VA get their drugs at the VA, but the Honor Plan is available to anybody that's eligible for Medicare. The Honor Plan has a robust dental coverage, access to an urgent care providers. It's a zero premium plan in every market across the country, and we are offering it in 46 states. And this year, the Humana Honor Plan is recommended by USAA, as are all the Medicare Advantage plans offered by Humana. USAA, as you know, is an outstanding service provider in the insurance industry to veterans, and very well known for their customer satisfaction and commitment to veterans and military families.
So you cut out just for a moment there, but talking about how VA benefits and Medicare benefits, you don't have to choose between one and the other. They can be combined together, specifically in what you were saying in terms of the plan that you offer.
That's correct. A veteran is essentially the quarterback of their care when they are eligible for the VA or for Medicare Advantage. They can use the VA at the times when they need to or want to. And they can also use the Medicare Advantage plan. They're entitled to both.
Mm-hmm. And you recommend seeing a licensed agent to have, if someone's inexperienced with this, maybe this is their first time and they're first qualifying, seeing a licensed agent to go through this process and sort of deciding what's best. How does someone go about doing that, and where can people get more information?
Well, I'll start with your last question. They can get more information through the Medicare Plan Finder at Medicare.gov. Medicare does a great job of illustrating all the available plans that are out there, especially the ones that are in a particular zip code where an individual might live. Or call 1-800-Medicare, and you could again get the information that you need. With Humana, an individual can go to humana.com/Medicare, see all the plans, including the Humana Honor Plan, that are available to you in your area. Or you can talk to a licensed agent with a push of the button while you're on the website. Or you can call 1-800-213-5286 and talk to a licensed agent from 8 in the morning until 8 in the evening, 7 days a week.
Mhm. Well, anything else that you'd like to add during this time? I mean, it's coming around the corner. Should people really get a move on? I mean, how long does this process take?
I think individuals just need to take a breath. I mean, there is still time to consider all the options that are out there. It's important to research those options. And it's, I think, very important for you to connect with a licensed agent so that he or she can understand what your healthcare needs are, what your financial situation is, that is what you can afford, and help guide you into the right plan.
Mhm. Yeah, I know a lot of people think they have to go it alone, but no, there's help out there, especially for this, right?
Yep, absolutely.
Gosh, well, anything else you'd like to add? Tell our audience.
No, once again, I just want to emphasize, for veterans and those who are eligible for Medicare, the Humana Honor Plan is available in 46 states. It is recommended by USAA. We're very proud of that. That USA stands by those plans. Their commitment to veterans is important, and we look forward to serving the veterans as well as any enrollee who chooses Medicare Advantage through Humana.
Oh, well, wonderful. Thank you so much for your time today and for this interview. It's going to help a lot of people. And of course, for your service to our country.
I appreciate it. Thank you.
Okay, take care. Bye-bye.